Hi, I'm Dr. Kelly Starrett, physical therapist and human performance advisor for H-Wave OTC. Now, you've selected an H-Wave OTC because you have heard that it can really help with post-surgical pain and facilitate decongestion. We can move the garbage out and bring the groceries in. So what we want to try to do today is show you some simple ideas around getting the most out of your unit. The bottom line for this is oftentimes after surgical repair, one of the things we're trying to do is limit the total range of motion of the shoulder. Oftentimes because we have surgical repairs, we have sites that have been stitched down or reattached, and what we're trying to do is protect those from some extreme speed and extreme end range of motion. So it's important that we support and give those tissues a chance to rest and recuperate, but the problem is that the whole limb, remember, is driven through decongestion through muscle activity and muscle activation. So by moving the arm is the way that we're going to get the muscles to contract to actually facilitate drainage of the joint, drainage of the soft tissue systems. The actual joint itself is drained by the deep lymphatic system of the body, which means if I don't contract musculature in and around the joint system, I'm going to have delayed sort of decongestion principles that's going to happen. So what ends up happening is that we can often see increased sensitization or increased pain response simply because the tissue is congested and it's difficult for us to get the amount of motion in to decongest the tissue. One of the things we get with H-Wave OTC is in the low frequency setting, we can get 2 contractions a minute, or 2 contractions a second, and we can do that for many, many, many hours. So what that does is facilitates movement without actually having to move the joint, or what we say is movement without joint or limb motion. And that can be a very powerful way for a couple reasons. The first is that movement of the musculature that happens in this non-fatiguing contraction signals to the brain that there's a lot of movement happening in these tissues. That can mean that the brain is less sensitive, or you might even feel on the other side that you're less afraid to move the limb for the first time. The other thing that happens is that when we have decongested tissues, we actually see humans heal at the rate of human beings. That a congested, swollen tissue is going to heal at a slower rate and potentially cause higher levels of pain feedback to the brain. So managing that congestion accelerates healing to our normal human rates, which is pretty phenomenal, and it can help us to manage potential downstream pain that's related to local tissue congestion. So the issue is you'll get your OTC and you're thinking, where do I put the pads? And the first order of business is if you're covered with a protective gauze or padding, don't worry about that. The physician and their staff has put that on to try to protect the wound site. But we have a lot of areas where we can get movement in lymphatics. We can pump the forearm, we can pump the biceps, we can pump the triceps, we can get the pec, we can get the rear of the delt. And what ends up happening then is we can stay well away from the immediate sort of surgical site, and we can be thinking, hey, what's happening upstream and what's happening downstream? So for example, let's say that Sean's had a little scope and they've just cleaned something up and they've trying to protect the biceps tendons. So we don't necessarily need to pull on the biceps tendon in the first area. What we can do is we can do something like hook up his triceps here and move the pad up to the back of the shoulder. So what we've got here is I've got a pad placement set up on the back of the shoulder and the triceps. He's going to probably be in a protective position. What he's going to do, and we start with a single lead here, so he's going to turn the machine on and then push low frequency on that lead. And so what we should be feeling here is just a little bit of a muscle contraction. Now the first time you put this on, it's a little bit freaky. It feels strange that someone has some muscle control over your body, but remember, it's you. So he's going to dial this up until he feels a comfortable muscle contraction here. And what we're trying to do here is actually develop some pumping. So I don't see kind of a good solid pump yet. Can you go a little higher? Now we start to see the actual muscle jump. Now, he doesn't have a surgical shoulder right now, so dial that thing up and get a massive contraction. You can see at this point, that's probably going to be uncomfortable. He had a surgical repair. And he doesn't need this level of activity to actually move the lymphatics and dump the lymphatics or get the muscles to move. So he just needs to have a little bit of movement in the system. And more importantly, that feels comfortable to you. So in this situation, we've got some movement, and already the brain is getting input from the movement. That's that pain gate theory, that if I have movement in the system, that's going to sort of compete with the pain information around the brain. And that's going to be really important when I go to sleep later on at night, because having some input into the system can make it a lot more comfortable when I have sort of immediate pain. And when I lay down and I'm not moving anymore, there's no more input in my brain, oftentimes your brain starts to perceive the thing that's achy or a little bit sore as the big primary. So if we can keep some movement in the system, especially during night, that's amazing. Now, we can also set up, let's say that he's not getting a good contraction there. He can leave the device actually on and move the pad around in real time until he gets a contraction. So you can set that up, and you can see that we've got rear of the shoulder, front of the shoulder, and we're still creating. I can move this pad in real time. I don't necessarily have to turn the machine off and reset each time. I can just keep moving until I get what I'm after. Again, you may need to adjust up and adjust down. Our basic rules are that if you feel like the thing is pulling on one of your surgical incisions, or it's somehow irritating to your surgical site, you're not using the machine correctly. None of this should be irritating to your spot, especially in an acute setting. Later on, this can be a really powerful way for us to get some movement in tissues that are ready to get a really sub-threshold load or low kind of tension load in the system. But in the meantime, none of this should be uncomfortable in the body. He can set up multiple pads, and we can even do one system that's set up for high-frequency pain control for an hour, and the other system set up for decongestion. What we like to say is, hey, you should probably have a dose and see how you respond to this. And so it's very comfortable to get an hour in and see how you feel. And that would be the equivalent of you walking for your hour or moving your arms for an hour on something like an exercise bike with arms or rowing. It's actually physically impossible to get that much movement in the system in your upper body. So any movement that we're getting, great. Take an hour, see how it goes. Just make sure that you're not having some soreness. Make sure that you're not having irritation under the pads. But understand that we, in our clinical setting, use this a lot and have people fall asleep on it. We have them get as much motion as they can throughout the day. And basically we say, hey, if you have an opportunity to be decongesting and moving the tissues, let's go ahead and take that opportunity. And we kind of, our loose in-house clinical model is we like 20 out of 24 hours on this thing. It's going to be impossible to get that much. But oftentimes what ends up happening is that people feel like, hey, unless I can do 2 or 3 hours of this, it's not worth it. Think about how much movement and how much better you'd feel after a 20-minute walk. So even a small 20-minute intervention can be really powerful for decongesting the tissues and getting non-threatening movement input into the body without actually having to move the limb. Again, you don't need to be precious about the pads placement. You can work downstream, you can work upstream, you can stay away from the surgical site because you're afraid. That's okay. There's plenty of other tissues to go. And remember, the whole limb and the whole region helps decongest the whole limb and whole region. So if we're pushing and pulling above and below, we're going to have a great outcome, even if we feel like we can't get on the actual surgical site. The bottom line, get comfortable, have a dose, have a response, and then start pumping. Happy healing.